It often starts in the most ordinary moment. A woman is working, traveling, relaxing, or even lying in bed at night, when suddenly she feels an urge to pee. Not a normal urge, a strong pull, a feeling that she must go immediately. She rushes to the bathroom, but when she reaches there, only a little urine comes out. She feels relief for a moment, but within minutes, the urge returns again. This cycle continues all day, sometimes all night. And the most confusing part? There is no pain, no burning, no infection symptoms. Nothing that looks like a classic UTI. It feels harmless at first, but slowly it becomes a mystery that disturbs her routine, her sleep, her confidence, even her emotional peace. Most women assume urgency means infection, but when the urine test comes back normal, confusion begins. Friends say it's stress, family says it's weakness, some say it's psychological, but deep inside her mind, she knows something is wrong. Something subtle, something hidden, something the tests are not showing. And this is where the real suspense begins. An unexplained urgency that hides behind normal reports, but continues to disturb daily life. I'm Dr. Ayurmoolam, and today we are unfolding the hidden layers of a condition many women silently experience but rarely understand: urinary urgency without pain. This topic matters because women often get misdiagnosed. Many take antibiotics repeatedly when they don't need them. Some suffer for months without answers. Some assume it will go away on its own. And some start thinking that urgency is part of their natural body rhythm. But urgency without pain is not a trivial issue. It is a signal, a message the bladder, the nervous system, the hormones, or the pelvic muscles are sending. And when that signal is decoded, the story becomes unexpectedly clear. Imagine a woman standing in a crowded supermarket. She has a trolley full of groceries, but her focus is not on shopping. Her eyes are searching for the nearest restroom. She feels her bladder pulling again and again. The urge keeps distracting her. She avoids drinking water because she fears needing to pee too often. She stops going for long travel. She even starts saying no to social events. Urgency steals confidence slowly, silently. And because there is no pain, people don't take her seriously. But urgency can be more frustrating than pain, because it comes without warning and without clear cause. Symptoms of urgency without pain show up in different ways. Some women feel frequent urination, 10, 15, even 20 times a day. Some feel urgency at night, disturbing sleep. Some feel pressure on the bladder even when it's not full. Some feel a strange sensation as if the bladder is tight. Some feel they cannot fully empty the bladder. Some experience urgency right after drinking even small amounts of water. Doctors observe patterns during examination: pelvic muscle tightness, irritation signs, mild inflammation, hormonal dryness, or stress-driven nervous system activation. But the real suspense lies beneath. What causes urgency without pain? The first hidden cause is overactive bladder, a condition where bladder muscles contract even when the bladder is not full. The signals between the brain and bladder become overly sensitive. No infection is present, yet the urge feels strong. This happens due to nervous system imbalance, stress, caffeine overuse, dehydration, hormonal changes, or bladder irritation. The second cause is pelvic floor dysfunction, when pelvic floor muscles become too tight, usually due to stress, sitting long hours, anxiety, or childbirth. They put pressure on the bladder nerves. This creates a false signal of urgency. A woman may feel she needs to pee, but it is actually the muscles sending the wrong message. Ayurveda describes this as vata imbalance, where tension accumulates near the lower pelvis and disrupts natural urinary flow. Another hidden cause is interstitial cystitis in its early stage. This condition causes bladder irritation without infection. The bladder lining becomes sensitive, reacting to even small amounts of urine. Women feel urgency, frequency, and pressure without burning. Many women suffer for years, thinking it's minor, but the bladder is trying to communicate deeper inflammation. Hormonal imbalance is another strong cause. Estrogen supports the urinary tract. When estrogen goes down during PMS, postpartum, perimenopause, or stress, the bladder becomes more sensitive. The urethra becomes dry. The tissues lose elasticity. Urgency appears suddenly and repeatedly. Overhydration can also cause urgency. Women who drink excessive water throughout the day trigger their bladder unnecessarily. Similarly, dehydration concentrates urine and irritates the bladder, also causing urgency. Both extremes create the same problem. Caffeine, tea, energy drinks, artificial sweeteners, spicy foods, and acidic foods irritate the bladder lining and trigger urgency. Some women don't connect their dietary habits to their symptoms, but bladder irritants play a bigger role than most imagine. Urethral syndrome is another reason. The urethra becomes irritated due to friction, changes in weather, low hydration, or intimate activity, creating urgency without pain. And then there is the emotional layer. Anxiety increases adrenaline. Adrenaline tightens pelvic floor muscles. Tight pelvic muscles compress bladder nerves, sending false urgency signals. This is why women under emotional stress often feel like they need to urinate even when their bladder is nearly empty. Diagnosis becomes the turning point of the mystery. When a woman comes with urgency without pain, the first step is to rule out UTI. Once tests show no infection, the investigation deepens. Doctors check bladder habits, fluid intake, food triggers, menstrual cycle connection, stress levels, and sleep quality. Ultrasound may be done to check bladder emptying. If needed, post-void residual urine measurement is done. For hormonal imbalance, blood tests may include estrogen, progesterone, thyroid hormones, and prolactin. For suspected interstitial cystitis, cystoscopy may be done. Ayurveda diagnosis includes dosha assessment, digestive strength, emotional overload, and vata imbalance signs. Women should consult a doctor when urgency becomes daily, interrupts sleep, disrupts routine, affects mental peace, or continues despite normal urine reports. Now we move to solutions. The first pillar is diet. Bladder-friendly food reduces irritation. Avoid caffeine, coffee, strong tea, carbonated drinks, spicy food, vinegar, tomatoes, citrus fruits, and artificial sweeteners for a few weeks. Drink enough water but not excessive. Prefer warm water. Include coconut water, fennel seed water, ghee, cooked vegetables, bananas, pumpkin seeds, oats, and pomegranate. Ayurveda recommends avoiding cold and raw foods when vata is high. Warm, nourishing meals calm the urinary tract. The second pillar is exercise. Pelvic floor relaxation exercises are essential. Child's pose, deep squats, butterfly pose, pelvic tilts, and breathing exercises release tension. Overactive bladder improves with bladder training, gradually increasing the gap between urination. Light walking improves nervous system balance. Yoga reduces stress hormones. Women must avoid strenuous exercise during symptom flare-ups. The third pillar is medicines and supplements. Depending on cause, doctors may prescribe medicines to calm bladder muscles. Magnesium helps relax pelvic muscles. Vitamin D improves nerve function. Omega-3 reduces inflammation. Ayurveda herbs like Gokshara, Punarnava, Varuna, and Chandraprabhavati support urinary health. Brahmi, Jatamansi, and Ashwagandha reduce stress-induced urgency. For dryness, estrogen creams may help in perimenopausal women. The fourth pillar is lifestyle and Ayurveda tips. Never hold urine for long periods. Never overhydrate. Do not use harsh intimate washes. Avoid cold beverages. Use heat pads during episodes of urgency. Practice deep breathing before bed. Reduce screen time at night. Maintain a fixed sleep schedule. Ayurveda recommends warm oil massage on lower abdomen to balance vata. Drink Jeera Dhanya fennel water daily for urinary cleansing. Keep bowel movements regular because constipation increases bladder pressure. Let's make it simple with a do and don't list. Do drink water in small sips. Do avoid bladder irritants. Do relax pelvic muscles. Do manage stress. Do track your symptoms. Don't take unnecessary antibiotics. Don't drink too much water at once. Don't suppress emotions. Don't overthink urgency. Don't rush to the bathroom at the first slight urge. Train the bladder gradually. Prevention and long-term care are straightforward. Maintain steady hydration. Sleep on time. Eat warm and balanced meals. Include yoga weekly. Keep stress under control. Reduce caffeine permanently. Build a routine of relaxation exercises. Avoid long sitting hours. Improve digestion. Support bladder health with nourishing herbs. Over time, urgency reduces and the bladder becomes calmer and stronger. Now imagine the woman again, the one who felt urgency every hour. After understanding the cause and applying the right changes, she sees improvement. Her nights become peaceful. Her days become normal again. Her confidence slowly returns. She realizes that urgency without pain was not a mystery after all. It was her body asking for balance. If this explanation helped you understand your bladder better, like the video, share it with someone who may need this information, and subscribe to Dr. Ayurmoolam for clear and practical women's health guidance.